I am a pediatric neurologist and clinical neurophysiologist in San Diego, California.
I am a certified nurse midwife here at Chas Center in Detroit, Michigan.
I'm currently a third-year medical student at UCSF in San Francisco.
I am a senior nursing student.
Yeah, so applying to medical school is not cheap at all. It's a very expensive process, and it begins at the first stage, which is submitting your AMCAS application. So that has its own fee, and then every school that you send your application to has a fee. I think on average, students apply to about 16 schools nationally.
So being in a predominantly white institution and being a minority in a predominantly white institution puts a burden on us minorities. You have to always be the best in order to just compare to other white students.
There many times has to be somebody that gives you that leg up. And many times it's a white person because there's not people of color in those roles. So if the gatekeepers don't allow you in and don't support you, many times you won't have that movement. I am of African-American and Mexican descent. Having a racial identity that's different from the body is automatically going to set you apart. So there's a lot of underlying bias that I think people don't know they have, right? If you devalue me as a person on the street, you're going to devalue me as a provider in the clinical setting. I was a part of a birth where I was disrespected quite significantly by a physician in front of my peers and residents. It's like, how could you even think that you would know that this patient needs C-section? And how could that brown mom, black mom know this is what she needs? I know what she needs. And it caused for the baby to pass.
Programs like Meyerhoff, I think, are so instrumental in even getting people kind of into that initial pool and helping support them and helping them keep thinking that, hey, this is something that you can do. And here are the tools to help you be successful. Meyerhoff Scholarship Program started kind of focused on African-American males, getting them into science, STEM disciplines. And so over the years, it became a little bit more diverse as far as, obviously incorporating women. And it's not also just restricted to African Americans. It's a little bit more broad as far as diversities. And so really, it's kind of a mentoring program kind of at the core of it.
Financial support is huge. I think that's a huge barrier to students being able to, one, apply to medical school, and two, interview at medical schools, and ultimately attend medical school. That's probably one of the biggest barriers that historically and continues to affect the number of minority students that are able to gain access to medical school. So whether that be through scholarships, travel stipends to interview, or even to just visit the school and show students that this is what medical school entails. These are some Black and Latinx students that we have here, and they're here to support you. And I think money can play a big role in ultimately showing students that the schools do care and they do want you there. How we can better work to diversify medicine and kind of retain and recruit Black doctors. I think we need to go deeper into the pipeline. I think we need to be starting at elementary school, middle school. They need to have positive experiences with science. They need to have positive experiences with their science teachers.
During my first year, I was actually able to go overseas in the Minority International Research Training Program. I went to Lancaster, England for a summer, worked in a research lab there. And I said, this is so fascinating. And that kind of set me on my path. So I came back to UMBC and said, I love neuroscience. That's what I ended up doing my PhD in neuroscience. And I'm a neurologist now.
I love helping people. If I wasn't doing nursing, I don't know what else I would do.
What drew me to medicine was a number of reasons. One, I was always exposed to it from my parents. My mom's a pediatrician and my dad's also a professor of medicine.
I will first present a life of joy. I think many times when it comes to a career, we're so focused on titles and money. It's a benefit for them to know that, wow, she's a midwife and a nurse and she's so happy. I want to be happy.
I think a career in medicine will really allow me to kind of combine all my interests, the two main ones being research and clinical medicine, into a meaningful and impactful career that allows me to connect with people, develop longitudinal relationships, and also hopefully make long-term impacts on the science and the research moving forward.